Okay, so I want to just real quick give you some highlights, things that I want to make sure that we've discussed. So we've got the chronic illness, we've got the acid base, and the EKG, right? So chronic illness, make sure that you know how patients behave when they've had a chronic illness for a long time. And then make sure that you know the difference when they've just been diagnosed. And there should be a part in your book that kind of discusses that. So kind of the overall behavior, and then is there anything that as a nurse that you need to, like nursing considerations for people that have chronic illness. So make sure that you've got that. And then there's something called the trajectory of chronic illness. Make sure that you look that up. It's basically the pathway that people with chronic illness go. It's like if you're talking about grief and how people go through the stages. This is the trajectory of chronic illness is kind of the same thing where they go through different phases from when they first diagnosed. So make sure that you understand that, and then where you fit in as a nurse. So you know they're in phase whatever. This is what I need to focus on. Okay? And then geriatric. The stuff with geriatrics is usually, I'm old and I have these symptoms because I'm old. Right? And we know that's not true. Very rarely is that true. So you need to think about when you have a patient who thinks something is related to their age, or they make a statement, you're trying to figure out, do they think that because they're old, or are they saying that because that's a symptom of their disease? Okay, so kind of understanding that concept and read that little blurb in the book. Okay? We also have IV infusion, right? So the IV infusion, make sure that you review the steps of the IV pump. You know, how you use it, how you set, like, you do A, B, and C, what do you do next? You know, if you had to explain how to prime something, you know, what's the next step? Or what order are the steps in?
So your video, like
my videos, yeah,
it?
that's good. So kind of like I don't know what I was going to write there, steps. So if you had 1, 2, 3, 4, 5, and it said put them in order, you could drag them and put them in the correct order of steps. Usually look for the what's first, what's last, and fill in the middle. Okay? And then, of course, complications, phlebitis, infiltration, and then what do you do about the complications? What's the first thing you do when you have a complication with your IV site? Stop the IV, that's right, okay? You always treat the patient first, okay? You assess the patient first, you treat the patient first. You just got to make sure that you didn't already do something in the question, right? Okay. Make sure that you guys know the type of fluids. So, and I think you guys already know this because we've talked about this a little bit. So like isotonic is normal saline and lactated ringers, stays in the vessels. We use it to increase blood pressure and hydrate, yada, yada. And then the hypotonic, hypertonic. Okay, so make sure that you know which solutions are which. There's stuff on my website. There's like a table, and it shows all the different fluids, and it tells you what kinds of IV fluids they are. Or you can go on Pinterest or whatever. They're out there. And then we have central line. Central lines are on there, right?
Yeah.
Yes.
Okay. So central lines, so indications for central lines. So acutely ill, a lot of caustic drugs, things that if they infiltrate, you're going to have necrosis and lose the extremity or whatever. Trauma, you know, that kind of stuff. TPN, they don't have to have a central line, but it's more effective. You can give them more sugar, okay? And then dressing change, and care of the central line. So the start-stop method for flushing, the bio patch, the putting the mask on you and the patient. So make sure that you know the steps for that as well. Okay, and I think there's a video on my, or even a checklist on my website. Central lines are also PICC lines. This is all the same thing. So when you see PICC, you should think central line. Okay, that's something that sometimes we mistake. And let's see, if you're treating somebody for, you're giving them IV fluids and you're treating them for like decreased fluid volume, dehydration, how do you know it worked?
Increasing blood pressure.
So it could be any of those things that you guys are mentioning. It could just be a list of choices of normal things. So it says the patient came in with their dry mucous membranes and no urine output and dry skin and whatever, right? So you know that they've been throwing up for 3 days. So you know, okay, they're dry. And you are the nurse is administering 150 mLs an hour of normal saline for the last 6 hours. How do you know treatment is effective? You're just looking for normal things that are about hydration, right? So it could be anything from moist mucous membranes to 30 mLs of urine output, or the urine is now clear, or whatever, okay? So it's not necessarily something, it's not gonna say like, well, now the urine output is 60. It's just gonna have a list of normal and abnormal things, okay? The urine output would be more indicative than the blood pressure, because lots of things can increase the blood pressure. There's very few things that increase the urine output, right? Okay, and then like fluid overload, because if you're giving someone fluids or they're on fluids, then you may have a question that talks about complications. Which action would require intervention? And all the question said was you got a patient with normal saline running at 100 an hour. Well, if I give IV fluids, what's going to happen? They're either going to have an IV complication at the site, or they're going to go overload, right? In which case, what are you going to do first? I'm going to stop the IV, and you don't need a doctor's order for that. You stop the IV, assess your patient, okay, and crackles and all the things that could be asked about that. Okay, so that's kind of an idea about that. All right. And then we've got acid base. So make sure that you can analyze blood gases okay, that you remember how to do that well. I know we did that a while back. You guys were really good at it. So just double check it. Just, do a couple practice problems. And then you're going to want to take all of your different conditions, however you want to organize it. Oops. I got a lot of metabolic stuff going on right there. Okay, whatever, you get the point. So you're going to put all the different blood gas things, and then you're going to say, okay, well, what might cause this? What does that look like? How do I treat it? Okay? How do I know it's effective? Okay, so those are important things to you make sure that you know. Which one do we get with DKA?
Metabolic acidosis.
Right. Okay. Anything with a positive cation ion, 1 plus, 2 plus, doesn't matter, it's got a plus on it, that's going to make you acidotic, right? So we've got ketones, we've got, this would go on your acidosis page, lactic acid, we've got potassium, we've got CO2, okay, anything that is a cation, and will make you acidotic. What do your blood vessels do when you're acidotic? They dilate. What happens when your blood vessels dilate? Your blood pressure goes down. What's the end result of a low blood pressure?
Heart rate and
Your heart rate goes up to compensate. Decreased perfusion. Who cares about decreased perfusion?
who cares?
Who cares?
We do.
What happens if you don't have perfusion? You don't get oxygen to your organs and you die. It's called multi-organ failure. And you guys know how to assess perfusion of every organ. You don't need a fancy catheter. You don't need a fancy pressure line, although we like them and they're fun. If you just go head to toe and think about how do I know they're getting perfusion, well, the brain's getting perfusion if they're not altered, right? Their LOC is fine. My lungs are getting perfusion if I have a good SAT and I've got a good, respiratory pattern and my lungs are clear, etc. You could do that with every body system, okay? So this would all go on your acidosis page. And it's going to cover a lot of problems, okay? Compensatory mechanisms, so you want to know what does your body do normally to counteract this. So we know that if it's a metabolic problem, our lungs kick in and they help. They either get rid of CO2 or they retain CO2, whether you're acidotic or alkalotic. If it's a respiratory problem, what kicks in? Your kidneys. Your kidneys should kick in, okay? So make sure that you know that, and don't just keep it general like that. Think, okay, well, if I'm in respiratory acidosis because my CO2 is high, and I help my patient take a deep breath, I put high flow on them, or I give them an incentive spirometer, or I make them turn, cough, and deep breathe, right? So that they can get rid of more CO2. When it's effective, they're going to have a normal breathing pattern. Of course, their CO2 is going to get lower. They're going to be more awake because the CO2 makes you sleepy. That's the kind of stuff you need to think about, okay? And then any of the conditions that you guys had in your, that we've talked about, pneumonia, what else have we talked about? PE, whatever other conditions that you either had in the reading or have on your objectives, think, okay, well, I have a patient with pneumonia, what am I looking for? They're probably going to have respiratory acidosis, it's a respiratory problem, and I'm going to have a problem exchanging because I'm full of mucus and I'm inflamed. So you could have a patient with pneumonia, and the question could be asking what the priority of care is. Well, you're going to be treating acidosis, or it may be that they want you to, give antibiotics or something. So make sure that you kind of frame everything with an ABG, everything that you're studying, okay? Is there anything else, or is that, EKG, cardiac.